Hi, my name is Dr. Nikhil Shah. I am a gynecologist practicing in Borivali at my own hospital called Maternity and Nursing Home located at Gorai. So today we are going to talk about a very pandemic problem, you can say, which is known as cervical cancers. Now this is something which each and every woman should know, because some or the other area at any age it can catch up with you. Whether you are 18 years old, whether you are 35 or you are 45 or 60, this cancer can catch you at any moment of life. And that is why we are making this video, just to share information in your own way, how to manage cervical cancer and how to prevent. Now, why was it that the cervical cancer was not even heard of before, and now you have now listening to a lot of cervical cancer cases here? This is because we have asked this demon to come in. We have changed our strata society, our norms, our trends, our lifestyles, and that's why this cervical cancer has walked in our life. Like what? Like early age of intercourse. Girls are now having intercourse at a very early age, and that is why we are seeing the rise of cervical cancer. The second reason is multiple sexual partners. Please note that by wearing a condom, and if you have a multiple sexual partners, you cannot prevent cervical cancer. Third most important is smoking. Only smoking can increase the risk of cervical cancer by as high as 16%. Now you have a virus called human papilloma virus, which we call HPV, which is usually transmitted by the males to the female. So your partner, your husband, anybody can be harboring or having this virus, and he himself may not be knowing. So he will be passing on this virus during sexual activity, and that's how you are stuck with cervical cancer. So you cannot say that I am not sexually active and I am not getting cervical cancer, because this virus can be passed even through hands and fomites. Now talking about cervical cancer, how it does, how it spreads, this is not the era of treating cervical cancer. This is an era of prevention of cancers, and that's why we are here. So if all the cancers in a woman, where you talk about breast cancer, uterine cancer, ovarian cancer, we have good news for you that cervical cancer can be prevented. Now how? Of course, the high risk factors I told you, early age of intercourse, smoking, multiple sexual partners, all can be prevented to a certain extent. But still, remember, your partner can still transmit the virus to you. So what is the solution? The solution is very simple. The solution is one vaccine. Just 3 or 2 doses of one vaccine can bring down your risk of cervical cancer as high as 95%. The rule is very simple. If you are taking this vaccine before 14 years of age, that is between 8 years to 14 years, just 2 doses. And if you are taking this vaccine beyond 14 years up to 45 years, just 3 doses. So 1 dose now, 1 after second 2 months, and 1 after the 6th month. So just imagine, just 3 doses of a vaccine can prevent cervical cancer by 95%. Now there may be many people who will be telling you, okay, it is very costly. I mean, we have not heard of it, but we had never heard of COVID, and yet we took so many doses, so many shots, right? So imagine the cost of cervical cancer must be somewhere around 4,000. So 4,000 into 3, 12,000. Over a period of 6 months, you invest 12,000 and you bring down a cancer which, if needs to be operated, goes in lakhs of rupees. I'm not even talking about the pain and the surgical scar you're going to get. So I think you all should be aware of the cervical cancer, and more than that, how to prevent it. So whichever age group you are between 8 to 45, please don't shy away. Start taking these doses, and imagine 3 doses only in lifetime. There is no booster dose, there is no additional dose, and your cancer goes down by 95%. That is why we all doctors are going to schools and colleges and trying to spread this information. So wherever you are, if you have any of the girl crowd around, any of the women crowd, whether it's your sister, your daughter, your mother, or your mother-in-law as well, please spread this information and go to your nearest gynecologist and take cervical cancer vaccine by the name Gardasil. All the best.